anyways, so how did your procedure go, Tamlin?
It went great.
Yeah?
Yep, it was very easy. The prep was easy and all that was good, so.
And
no
you
problems.
felt fine afterwards?
Yes.
So tell me, how's your irritable bowel symptoms?
Oh, so much better. Yeah, the Lotrex for me has been just a lifesaver. I've been feeling so good and just great.
Okay.
Great.
And you have not had any side effects with that?
No side effects at all.
So how did it change your quality of life?
Oh my gosh. Complete different.
Give me an example of what you can do, what you couldn't do before the medication was given to you.
Yeah, before it was just, you just
wasn't
never
that
knew when it was
a
going to
while
hit.
You went and saw some other doctors about it, and you've been suffering with this?
Yes, for a long time. So I had the drug originally in 2000 when they first released it, and then they pulled it off the market, and then the doctor I was seeing at the time didn't even know they ever brought it back. So I was suffering for that whole time before I found you online and decided to come back and see about it again. And it was just so different. My life was just completely changed. You just never knew when you were gonna have an attack, and it was so painful and so disruptive to just life in general. And like driving in the car and stuff was just worrisome because you just didn't know if you were gonna be in pain or what was gonna happen. So the medicine just made it so much better. First of all, the pain is so much better, and I'm not worried about things that I used to be worried about. So a lot of the stress in my life is actually gone because of that. So
nice, very nice. I'm so happy to hear that. And you have not really had any side effects since then, and you've been on this medication for
almost 4 years.
4 years now.
Yeah.
And you were off of the medication for what, good 10 years? And suffering for 10 years?
Yes.
Before you came to see me?
Before I came back, exactly. Yes.
Wow.
And it's been great. And you, of course, have been just awesome in giving me options and telling me what to expect and all that. And everything has worked out just like you said it would. And I'm so happy.
Procedures have been good, and
yes, procedures
no
are
side
great.
Effects and no problems.
No
and how was the prep for the colonoscopy that everybody dreads about?
This is the most awesome one that I've ever had to do, because with whatever method it is that you use, you actually get to have a little bit of breakfast on that prep day and a tiny bit of stuff for lunch, and so you're not like starving yourself the whole day, which makes it worse. But super easy and not like bad tasting, and it's really not that bad.
Good.
It's not bad. Yeah.
You know, we are still trying to improve our colon cancer screening, and we are still approximately 50% of the patients are still not screened for colon cancer because of the fear of colonoscopy.
Right.
So it's good to hear from the patient's mouth that how easy the prep is and how easy the procedure is.
And the procedure is so easy, especially with the anesthesia and stuff, as long as you're okay with having that.
Well, it's not general anesthesia.
No, it's not. It's actually like that Twilight
sedation
stuff. Right? Yeah, sedation. Yes, exactly. So, but for the patient, it's like anesthesia. I mean, as if you had just no stress, no bad memories. No anything. Exactly.
Good.
Yes.
And the office has been good to you, scheduling wise? No problems?
No problems at all. I can get in anytime I need to, pretty much.
It's almost like a concierge style of gastroenterology practice, isn't it?
Yes, it is. It is.
Good.
Exactly.
I'm just so happy. I'm really happy that
Me too.
you are happy, and so we are all happy then.
Yes.
That's good.
That's great.
Okay.